let me introduce my guest to you, and I'm going to have Kwame Esiedu, Sapon Esiedu, who is a pharmacist and fellow, Ghana Center for Democratic Development, CDD, via Zoom. Dr. John Amuasi, who is lecturer, Global Health Department, School of Public Health, KNUST, and leader, Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine, KCCR. Thank you, gentlemen, for making time to join us via Zoom. Right, and here in the studio, particularly for the very final part of the discussion, which is a bigger discussion too that we'll be having about the manifestos discussion. The NDC has done a lot of work on the MPP's 2016 manifesto and scored it 14% for job done so far. Not what Imani scored it, and not what President Akufo-Addo scored himself sometime in the course of the year. Imani says that NDC is very stingy for scoring the MPP that low. In the studio is Samuel Nete George, MP Ningo Pram constituency. Good morning and thank you for joining us.
Good morning, Samson, and good morning to all viewers.
Great. All right, so we will be dealing with the legal education matters, which have also dominated discussions in this country for a while, but it does look like we are getting closer to a solution to that. And to help us do that discussion will be Ace Ankoma and Dr. Dominic Ayine. They, the former Deputy Attorney General, they will help us to look at that report damning about some of the law faculties. We'll tell you the details of the report later. Dr. John Amuasi, thank you very much for joining us on NewsFile.
No, thank you very much, Samson, and a very good morning to you and to the listeners all over Ghana and the world.
Thank you very much. Now, start off, do you have reason to agree with Occupy Ghana in its statement that there is a suspicion of suppression of the data, particularly in respect of the death that is recorded? And a clear example was cited about the figures in the Ashanti region where you are.
Well, thanks for this question, Samson. Once again, good morning to everyone. I think it's a really important question that you ask. Because death is a very important event. I mean, it's a terminal event which everyone will be subject to, and people want clarity about death or otherwise. It is very clear that there are suspicions. All right, people have expressed their concerns, and well, a suspicion is a suspicion. As to whether it is the reality or not, it's a different question. But every suspicion, particularly in a matter like this, is worth investigating, worth inquiring further on. But let me just give you a little bit of background, then I'll comment very specifically on this issue of whether the deaths are being hidden or not. One is, it is very clear that across the entire continent of Africa, the epidemic seems to be gaining, or the pandemic seems to be gaining traction or gaining speed. That is, it is accelerating. However, when you look at the rate at which countries are reporting infections and deaths, this has decreased drastically for some reason. I mean, you can look just above Ghana to Burkina Faso, and the numbers have been pretty stable for a very long time. And you look at several other countries and you realize that there seems to be something going on with the reporting. Look at the story of Burundi, for example, and how the president of that country, Nkurunziza, who I know I met personally a couple of years ago, and he literally hounded the WHO out of his country, declared Burundi coronavirus free and under a special protection from God, because he was a preacher himself. only for him to die out of coronavirus, although not 100% confirmed, his wife to have been taken ill, and several members of his cabinet also to be ill with coronavirus. Now, this is what happens when a country or individuals refuse to allow the truth to become evident. At a certain point in time, you cannot hide. And I would like to say that when it comes to coronavirus, particularly the infections and the death, it is dangerous for any country or any entity to play politics with this, whether you're on the left or on the right, whether you're in government or in opposition. This is not the time, and I just want to make a sincere plea as a professional that this is not the time to play any form of politics, all right? I'll speak to the matter, but I just want to try and color it a bit for you so you see the bigger picture.
Right.
You saw how things turned out in the UK as opposed to several other European countries. The UK was among the latest countries in Europe to take action because their initial intention was to go for a herd immunity kind of strategy. And when they later realized that this was not going to work via the science, they changed course. But this was obviously too late. And you can see in excess of 42,000 deaths in the UK. It is very clear that this was an error on the part of the government of the UK. But even in this, you see the kind of politics that is played there, where it is not a politics of trying to gain any political capital because of what the government did and blah, 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 but real clear constructive criticism. And that is what I sincerely desire that we will have in our country, and not government trying to pitch as if all is well and the opposition trying to pitch as if things are chaotic. And now speaking specifically to the deaths in country, what I think is happening is that the deaths are not being reported on time. I believe this is because of the processes which the data goes through before it is released in the public domain. And I think, quite frankly, that this can be done a bit better. I think that we can report a bit quicker. I think the processes can be sped up a little bit, because what happens is the data or the information is aggregated from the various regions and then taken to, I believe, the headquarters of the Ghana Health Service in Accra, and then the necessary announcements are made. So what will happen is that when this data is being aggregated from across the regions, by the time the central authorities in Accra are able to peruse this and really clean up everything, draw their grasp, it is well likely that the information in the regions would have leaked into various channels. And this is what causes the discrepancy. I also know that there are issues, technical issues, around defining what a COVID-19 death is. Death with COVID-19, death of or from COVID-19. What are we talking about here? Somebody has a road traffic accident, is brought into the ER, and then dies a couple of minutes later. For some reason, somebody decides to take a swab, coronavirus positive. Now, does this mean this person died from coronavirus? Are you going to count that as a coronavirus death? All these are technical issues, all right? Somebody with terminal cancer, stage 4, all right, would have died maybe in the next 6 months, but their death got accelerated by COVID-19 infection. Someone with HIV/AIDS, tuberculosis, with all kinds of debilitating conditions, and they die from COVID-19. Are you going to report that as a tuberculosis death or a cancer death, or you call that as a COVID-19 death? And I think these are some of the technicalities which people may be leveraging to report things in different ways. All right. And what I would prescribe as the solution to these discrepancies is total transparency and the making available of data in its broadest capacity. Because after all, you will de-identify the individuals. You will not have the names of the individuals. So how difficult is it?
The issue of delay that you raise, does that explain why, even though at the time Occupy Ghana was raising the suspicion, you had 38 deaths that had been reported from the Ashanti region alone, and less than 20 of those deaths were included in the national count? The question of delay you raised, does that account for this?
Well, Samson, when I say delay, what I mean is a time lag between what is known in the books in a facility and what is reported by the government at the central level, all right? And a number of things can account for delays. And I really am not the one to speak to what is accounting for these delays. And a delay can be interpreted in different ways. You can interpret a delay as a deliberate attempt to suppress data. You can define it as a technical issue trying to really confirm death. You can do many things with it. What I can say on authority, without any shadow of doubt, is that there is a delay. Now, whether this delay is deliberate, whether it is a technical issue, I cannot speak to. But what I can also say is that this delay is not necessary, and this delay can easily be gotten rid of by people trying their best to provide the information as quickly as possible and also being as transparent as possible. There is no point in saying that X died of cancer and so you're not going to count it as a COVID death when the person may have had COVID. You're better off saying the person had cancer, was terminal cancer and blah, blah, blah with all the descriptions and also had COVID, and then leave it to the experts or whoever to be able to see that full swath of data and then make their conclusions out of it. But when you do not do this, and later it turns out that, oh, this person also had COVID, and you say, oh, the person also had cancer, and that is why we did not report it, then you raise the suspicions. And the moment people become suspicious of this kind of data, then the whole effort is going to lose its steam, and it's not helpful.
Exactly the point Occupy Ghana raises. At over 13,000 of infections, although we have 4,500 recoveries, we have hit 70 deaths. Is there something we ought to be doing now we are not doing? And are there things you see we are doing that might complicate our situation?
Well, Samson, to be totally fair and transparent regarding the deaths, you've got to accept that in this country, we are way, way, way better off than several other countries. The case fatality rate in Ghana currently stands at 0.53. When we say the case fatality rate, what we mean is the number of deaths out of those who test positive. In just neighboring Cote d'Ivoire, it's 0.71. In Burkina Faso, which I can tell you on authority definitely is doing some suppression, it's 5.88. In Nigeria, it's 2.54. In Cameroon, 2.66, and I could go on and on. There's 300 deaths in Cameroon, almost 500 deaths in Nigeria. So relatively, our deaths, even with this this perceived suppression, which might have some veracity, I cannot say 100%, is very, very low, which suggests that we are doing something right. But you can see how our deaths have increased over the past 2 to 3 weeks, and this was already predicted, all right? Because when you are unable to keep up with the virus, unable to keep up with your testing and quick identification of contacts because of the increased number of cases, you will naturally have people slipping down the cracks and having more severe disease. And you can see the reports on that we have 4 people on ventilators already. Hitherto, we would have 1 person or 0 persons on ventilators. And when you're on a ventilator, that's a dire situation. But people do come out of ventilators anyway, you see. So what I would say is, there will be a lot more recoveries. From my estimation as a professional, looking at the calculations, there will be thousands more recoveries. And I've stated over and over again that
how about infections? How about infections? You said there will be thousands of recoveries. How about infections?
Yeah, I've also said this again, and I'll not shy away. There will be definitely thousands more infections. I mean, this is very clear.
And there could be, and the infections. Are the infections likely to even rise higher because of some of the activities, political, that we are beginning to undertake? I've followed and listened to, respected physicians, including yourself and, say, Dr. Anthony Fauci in the US, and they say, without any equivocation, that mass gatherings no matter what you do to reduce the risk of infection, mass gatherings are fertile breeding grounds for infection and spread. We know today that the NPP's primaries alone, you have thousands who are gathering across the country, and it won't be too long. The Electoral Commission is going to expect in excess of how many, almost, 20 million people gathering all over the country.
No, thanks for that, Samson. I think it's a great question. Let me just break it down a bit. As long as there are cars on the road, there will be accident. As long as there are airplanes in the skies, there will be crashes. It's the rate of these that you cannot tell. But obviously, the more the cars on the road, the more the crashes you get, and so on and so forth. So for anybody to suggest that an increase in mass gatherings will not have any impact at all on the rate of infections would definitely be a lie, if I can put it that way. So it is clear that as we increase social gatherings, be they weddings, funerals, political activities like the primaries, and any other activities, including going back to school, there will be a rise in infections. This is clear. Now, the question, which I've always said really is what is your ability to detect these early enough? And the second thing is, what is your ability to prevent those who get infected from progressing to severe disease and then to death? The question of infections is very clear. If the objective was to completely prevent infections, and this was all that we had envisioned as a country, then we'd have a perpetual lockdown ad infinitum, because that is the surest way to prevent any spread of infections is by nobody going nowhere, if I can put it that way. Okay. But that is obviously not practical. Now, the decision as to what is practical and what is not, is it worth having that wedding or not? Is it worth having that funeral? Is it worth holding those primaries? Those lie in the bosom of those who choose to take those decisions. But as professionals, we will tell you that when you gather, there will be spread. When there is spread, there will be more infections. When
at this stage, even at this stage, that we choose to applaud ourselves in the way we are doing, our treatment isolation centers are getting full. Now, there is the truth that the people at the helm are a bit hedgy, being upfront with. But some of us know that these places are getting full up. People are being, asked to do self-isolation. People are being asked to be treated in their homes, remain in their homes to be treated, all because we can't find space. So where are we heading?
Samson, I don't think anyone has denied that the isolation centers are getting full, or has denied that well, I'll be surprised, I should say, if anyone says that the number of cases has gone down, or that the isolation centers are not getting full, or the treatment centers are not getting full. I think this is obvious to everyone, and it's very clear. And it is only to be expected, all right? And I think it's very important that authorities are very clear with this, also very clear with the expectation. And this is why the information is out there that, when you are ill, these are the numbers to call. When you are ill, report here and there, or stay at home and make the call, and so on and so forth. What I'm most concerned about, Samson, is not necessarily the rise in the numbers of cases, but our ability to stem the numbers of severe disease and death. And I've given examples a couple of times on the show of countries that were not able to necessarily stem the number of infections, but were able to stem the numbers of death. A case in point is Germany. Germany had just about as many infections as France, and even more than the UK. The last time I checked, it's been a while. But the number of deaths was remarkably lower. And so far in Africa, this is what we're seeing in Ghana. And our focus should be on reducing the severe infections and death by early detection and early treatment. and not get so fixated on the numbers of cases, because once the country is open, the number of cases will go up. The fight then becomes the fight of the citizens by practicing social distancing as much as we can.
I'd like you to give us,
and so on and so forth.
I'd like you to give us a little education on two issues briefly, and then we wrap up on this. And I'd like you to talk about the mask wearing. There are people who are saying that they have to exercise, and as they are, jogging and everything, now the law is that once you move out of your home, you must wear it. They are asking, is this healthy? Because the WHO also appears to have a publication that suggests certain times that you perhaps don't need the mask. Are they also people who, for medical reasons, may not require the mask?
Thanks, Samson. I think for everything, there is a price to pay. And I think that at the national level, the law of having everyone to wear a mask when they're in a public place or outside of their home, in the company of other people, wearing a mask is a fair law and is the right thing to do from a public health perspective. The ideal thing, the most ideal thing is to have people not going anywhere, people not interacting, but this is clearly not practical, or is only practical up to a certain point. The next line is to reduce the spread via particulate matter, which is often propagated via our noses and via mouth and via our fingers, our touch, right? So it's difficult to have a law saying everybody must have a bottle of hand sanitizer in their pockets. That's definitely not practical, although that would have been desirable.
It's practical.
So the easiest, the lowest hanging fruit is that of a mask. And we need to move, we have to move beyond the recommendation of everyone wearing a mask to making it a law. And I can tell you that the degree to which the mask wearing has fallen, at least from where I sit in Kumasi, in the suburb where I live, is so heart-wrenching. And right. It is disturbing to see, especially the young people walking around in masses with no masks.
Right.
And it is only when it becomes a law, prosecutable, that this will work. So I am 101% behind this law that masks should be worn.
All right.
I don't think there should be any exemptions. And if people need exemptions, they will need to apply for these via laid down processes and procedures. And I think there is always a price to pay. And I think the price to pay will not be too heavy for the mask wearing. And I think there shouldn't be.
Now, the next education I need to receive from you is what we are learning about asymptomatic people. And we seem to be getting an impression that there is a good number of people like that. Now, I have come, face to face with people who have been tested positive, but who, until the point they were tested, had no cause, to feel that there was anything wrong with them. Very happy, going about their work, energetic, everything else. Then, because of a contact trace or something, they get tested and they are positive. And even after they are tested, there is no sign of any, being ill. What is the danger in that situation where asymptomatic people, you have them in good numbers?
But Samson, the issue of asymptomaticity is a very important one in this disease. And that's perhaps one of the unique things. When we say asymptomatic, it simply means that there are no symptoms. You don't feel anything at all. And even within asymptomaticity, you may actually have a variety of graduations, right? We have people who may be symptomatic, but they just do not know. And so until you test for a certain sign, or in medical practice, you say a sign, you look for a sign, you will not find it. For example, people only get tested when somebody checks and finds out that they've lost their sense of smell. So they themselves may not have noticed that they've lost their sense of smell until someone says, hey, smell this, as a sort of a crude test or a screening test. They can't smell, and then they said, okay, let's have a test, and they turn out to be positive. There's also people who maintain their sense of smell, not have a headache, not having a fever, be perfectly fine, and they test strong positive. The literature suggests to us that in some parts of the world, you may have as much as 78% of people infected being asymptomatic. Now, if that's anything to go by, it should tell you that there would be a lot more people in Ghana who are carrying the virus, a lot more people in Ghana who have recovered and are just fine. And this is, again, the reason why I keep stressing that the focus should not be on the numbers of cases per se, because this really does not mean much, especially in the light of our testing regime. Because if you do compare...
Yeah, Dr. Amuasi, what should happen in the circumstances of the many who are asymptomatic, because they are simply refusing to believe that they have anything even after they have been tested, and some are refusing to go into isolation?
No, Samson, I was trying to develop a point because it's really important this issue of asymptomaticity goes down correctly. But since you're really interested in those who are asymptomatic and what that means for them, it is a challenge, because how do you tell someone that, look, you've got a problem here, when the only thing that says they have a problem is a piece of paper which has a plus on it or a couple of curves that tell them that you've got some virus inside of you, and yet they're feeling just fine. Again, this is exactly the issue that we faced during the HIV/AIDS pandemic, where people would go for mandatory testing, either because they're going to get married or for some other event, and they realize that they're HIV positive, and yet would be denying it because they would be having no signs and no symptoms. So asymptomaticity has been something that we've had difficulty dealing with over the ages in medical practice or in public health. Nonetheless, what this means is that people involved in risk communication, our communicators, and people like you, the journalists, and others, need to be able to develop messages which address this unique category of people, which incidentally happen to be in the greater majority. So it's very interesting, and this is, again, the flaw of biomedical science, where our focus, and this is what we call the paradox, where the focus is on people who are ill, people who are sick, whereas in actual fact, the focus should be on people who are highly at risk or people who might be asymptomatic. So the greater majority of people who have the virus will be people who are asymptomatic. So perhaps the focus should be on the profile of people who may be asymptomatic, pushing that message about asymptomaticity out there for people to be aware that, look, you could have this virus, but you could have no signs and symptoms. And I think the hook in there would be to tell them that, well, you've got a husband, you've got a wife, you've got children, you've got a boyfriend, a girlfriend, a grandmother, a grandfather, you've got people you love. If you really care about them, this is not about you and how you're feeling, it's about them. You could pass it on to them, but they may not be as fortunate as you are to be asymptomatic. They could catch this virus, have severe disease, and might even die. And if this message is put out there, I think it could take, and I tell you that many people don't even know of this idea of being asymptomatic. You can take a quick survey on the streets and ask people if they've heard of anything called asymptomatic. It's a big word in itself. And you'd be surprised that people don't even know that this is possible.
Dr. John Amuasi, we owe you a great debt of gratitude for the sacrifices you make to sit up, wake up early, and to help educate all of us in the country and beyond, the millions that are reached through this platform. Thank you so very much once again, Doc.
It's my great pleasure, Samson. Thank you.
Thank you. And you see, the last bit of what he said is part of my fear, that yes, it may be fine, you know, you may be fine and you are tested to have it. Then question is, your family, the people you are in contact with, and everybody else. I think that's the biggest fear there is about it. However, in the midst of that, what it means really is that all of us should be on the alert. Let's practice the hygienic and the protocols that we are asked to practice. Wash your hands as frequently as you can, or you should. Use your sanitizer or alcohol rub as often as you can or you should, and just stay away from crowded places. Also wear your mask. Very important. Wear your mask. Thank you.